Hi, welcome to our new orthopedic clinic here in Pearland, Texas. I'm going to take you on a little tour and show you what we have here. In our main lobby, we have a huge waiting area for our patients to be seated and greeted before they come back to our new clinic space. This is an overall 22,000 square foot office space, which has fantastic capabilities for all subspecialties that we have here in Pearland. So we're going to go on a little tour. We'll get a little panoramic view of our big office with windows out the front for a lot of natural sunlight. And then here's our desk to greet everyone in the front. We have patients come in, get a nice smile at the front, get checked in, and get ready to go. Bring you back into the clinic area. This is one of our two main entrances when we walk into the clinic. This particular hallway brings us right into our radiology suite. So we have 4 x-ray machines that are functional here so that we can get all of our x-rays done for our patients. So we have 3 along this bank and 1 along here. Each machine is set up so that we can take different x-rays from Scoli films, full-length films, and everything in between for our orthopedic patients. We have a beautiful waiting room here that we've put together so the patients can change and have a spot to either wait for their x-ray or be on hold to go to the room. When you come through x-ray, the whole design of this clinic is to funnel everyone in and around in one direction, so we're not repeating a lot of steps, but you can see the length of the hallways. We have 3 full hallways that have rooms all the way down. So altogether we have 44 rooms separated into these 3 hallways. So we'll come look over here in hallway 1. When our patients come through and leave x-ray, they'll come right over and we'll bring them over to our clinic rooms here where they'll get seen by the MAs as everything gets set up. So we're going to check out some of the exam rooms here in the clinic. We have these beautiful sliding doors that are really nice and easy for the patients in and out. And this is an example of one of our exam rooms on the front of the hospital. We have some beautiful windows so we get nice natural sunlight coming in. Nice space with, of course, our exam tables. And then every room is equipped with a computer system inside. Every pod has a workspace that's set up to allow our MAs and our physicians to have some private space to do their work in. So we can do our dictations, we can do paperwork, all the things that we need to do as we're working on patients. So this is one of our workrooms, and there's Dr. Park, our brilliant new spine surgeon here in Pearland. So we love having him here. But the spaces work out to between the 44 exam rooms, we've got 5 workspaces. As we walk through the clinic, all of the checkout is funneled towards the back side of the clinic. So you come in one direction and you're leaving in another. So it's sort of a horseshoe shape. So there's not a lot of repeat of your steps or walking back across yourself. So when we get to this back hallway here, there's exam rooms all the way up and down, but we have this lovely bank of windows where we'll be able to look over our training facilities once they're complete. And it's a nice add for the clinic. Again, it brings more of that natural light and open feel to the clinic. The tall ceilings, the bright lights, the nice white color, and the palette that was chosen for this are very soft and calming for the patients, and I think it's a really nice touch for the clinic. As we're walking through, we'll get to the end where our checkout facility is, and so that's kind of the final stop for everyone to get their visit completed, and then that will exit back into the main lobby again. On our way here, this is where we placed our DME room or our cast techs here, where we have a corral style setup. We can fit 4 patients at a time in here to do casting and DME bracing, all the things that we need there for our orthopedic patients. Now, also unique to this area is our setup for pain management and physical medicine and rehab doctors. Those 2 teams will be here. We have rooms set up here as well as a private C-arm suite here for procedural injections and other things that they might do. So this is a really nice add-in to our clinic, and that brings in the idea of having a one-stop shop for everything, and that's what we've got here. So including their teams, we also have every orthopedic subspecialty that we need. We saw Dr. Park, we have spine now, we have foot and ankle, sports, total joint, pediatrics, hand coverage, general orthopedics, and we have not only surgeons, but also physician extenders, and so we have a really wide team that can see a lot of patients and really be here to cover any needs that the patients have. And it's really nice to have all that in one place because we can refer to each other within the clinic. The patients have one place to come to and they know they can get everything taken care of here. We're headed to checkout, which is the final stop for patients as they're finishing their visit. We have a little seating area here for some overflow, and then we have our checkout here. So our patients get one final smile on the way out, and then we'll exit out the door back to the lobby. So as the patients come out, this is the exit back to the lobby and they get to finish their visit. Hopefully on a good note. We're very proud of this facility. It's a big, beautiful place where we have a lot of room for patients to come and get cared for. We're excited about having all of our subspecialties here, planting a big flag in Pearland, and really bringing UT to the forefront here from an orthopedic aspect. So we're up and running. We've got patients already coming through. They're loving the new space. They're really enjoying how big and free-flowing it is with all the natural light and all the availability that they have for care. So we're super excited. The patients are excited, and we can't wait to share with more people down here.